Hello, good afternoon. It's Dr. Chudi Ufondu of Snowspirations Global Health Solutions. I hope you're having a wonderful weekend. Today is the 11th day of September 2021, and today's topic for our YouTube live stream is going to be based on having a successful pregnancy when you've had a failed IVF. Very painful experience for so many reasons. So the simple question, is it possible to become pregnant naturally when you've had a failed IVF? Number one, is it possible to have a successful cycle when you've had a previously failed IVF cycle? So we're going to try and address these two questions. And to start with the first one, it's possible to become pregnant by yourself when you've had a failed IVF in the past. Matter of fact, it's even possible to become pregnant naturally when you've had a successful IVF in the past. We've seen couples that they've probably given their diagnosis and they found comfort in the fact that they might not be able to have their own babies. But guess what? Over time, they were not practicing contraceptive, sex, and they became pregnant by themselves. So it's possible for the reason why you were not able to become pregnant by yourself to correct when you've had either a successful IVF or a failed IVF. It depends on a couple of factors. So the possibility is there. Pregnancy is a very delicate process. When you check the process, when you correct the things we can correct, you can improve your fertility. So the chances of you becoming pregnant when you've had a failed IVF, when you've had a successful IVF, subsequent pregnancies becoming positive each time. You can become pregnant by yourself and you can succeed in becoming pregnant when you go for a repeat cycle. But this is what we have to be conversant with. Number one thing you have to do when you've had a failed IVF is to do what? To research. So when you're done with the emotions of feeling bad, of feeling depressed, of crying, or blaming yourself, or blaming your spouse, or blaming the doctor, when you're done, please book appointments. Go back to your doctor. Let's deconstruct. So a good IVF provider will not just tell you over the phone, oh, madam, we are sorry. The positive pregnancy test was what we are looking out for. We did our best, and unfortunately, you didn't test positive. That's not the right response. You have to find a convenient time for you, your partner, and the top shot guy in that IVF program. They will sit down and review their protocols and review every singular step of what they did. And they can look at things from a perspective of what we can do differently. When you do this, and if they truly did everything right, remember, the outcome of your IVF is dependent on a couple of factors: the egg, the sperm, the embryo, and the body of the woman, especially the endometrium. So if the eggs we used was of good quality, we normally grade eggs in IVF, just like we also grade the sperm. So if the sperm was good quality, what makes the sperm good quality? Good count, good motility, good morphology. So if we didn't have any problems with the sperm, which is very needful, and the eggs we used was cold, so we didn't have any problems with the eggs, high-grade eggs, and we also got good embryo. And we treated you properly, we stimulated, we did everything the right way. And we were so positive we're going to have a good outcome. When that IVF fails, it's possible the failure might be unknown. But in course of our review, if we discover things we could have done differently, maybe we were compromising on the egg, maybe we were compromising on the sperm, maybe we were compromising on the embryo. IVF is all about quality. When you have a quality egg, when you have a quality sperm, when you have a quality embryo, the possibility you're going to have a quality outcome is high. So it's a garbage in, garbage out. So if we are able to deconstruct what we did from a perspective of corrective measures, when we fix those problems, we can get a good outcome. So you might have had a failed IVF 2 months ago. And just, because you follow me and you're living healthy, you bounce back from your depressed mood, you bounce back from your bad mood, you go to the gym, you eat properly, suddenly you're sleeping better, and you continued making love with your partner, you can become pregnant naturally. The criteria that will make you to become pregnant is ovulation. So if you still have reserves in your body and you improved your lifestyle, and I'm going to be very specific and I'm going to be very particular. If when you had that IVF, your BMI was not within the normal range, that means your BMI is above 25 or is even hovering around 30. 30 is obesity. If when you had that IVF that failed, your BMI was 30, now you got pissed. You went back and you were able to push yourself to 25. The possibility of you succeeding naturally when your BMI reduced from 30 to 25 is very high. You have about 10% chance of becoming pregnant naturally. So your body weight can improve your fertility when you've had a failed IVF simply by modifying your lifestyle. If previously you didn't watch what you eat, and after the failed IVF, you started eating healthy, you eat your fruits, you eat your vegetables, you drink a lot of water, you avoid your alcohol, and you were working towards reducing your BMI. For both parties, both the woman and the man, you can become pregnant naturally. The determining factor for you to become pregnant naturally and a successful IVF cycle is what? Your current status as a woman. So if you still have eggs, you can still use that one egg. You can still use that 2 eggs. So that 1 egg can divide. Those 2 eggs can divide. But the most important thing is to maximize what you need to do. So I don't expect you to have a failed IVF in June. Then you use the remaining part of the year to mourn the failed IVF. And you're not doing anything. You're depressed. You're falling back. You're not putting in more effort. When you go back to the drawing board, when you correct the things we can correct, when we correct your hormone imbalance, assuming you had progesterone out of range, FSH out of range, LH out of range, if we can fix them by fixing your natural lifestyle, by giving you a couple of hormonal treatments, you can become pregnant. So in a nutshell, whether you succeeded in IVF, whether you failed in IVF, if you continue your PPP, you can become pregnant naturally by yourself. Matter of fact, there is this particular study we're actually using to see if becoming pregnant for the first time can open doors for so many fertility. So it appears that women that had a long-term infertility, when they become pregnant for the first time, subsequent pregnancies are very easy. We've actually seen it happen. So it's possible there are certain things that happen to your body when you're pregnant. We've also noticed some women that once they were able to overcome endometriosis and they became pregnant, endometriosis improved their fertility. So endometriosis is actually a known case that can lead to inability to become pregnant. So we notice that pregnancy can have a kind of a positive impact on subsequent pregnancies. So the key word is, so long as you breathe, so long as you have faith, keep on keeping on. You can become pregnant when you go for another attempt of IVF. So successful pregnancy after failed IVF is possible. The success of that particular pregnancy subsequently is dependent on the reason why you went for the IVF in the first place. There are a couple of factors that might have led to the failure in the first place. If we correct them, you can improve your chance of becoming pregnant naturally and also with assisted reproductive technique. Some causes of failed IVF might be from the way the egg was retrieved, the way we stimulated you, or how we handle the egg, or depending on the protocol we use. So protocols are different types of IVF. So some people might not go for intracytoplasmic sperm injection for the first one, but they go for the second one. We do that. When we are going for intracytoplasmic sperm injection, what are we doing? We are collecting the sperm. We are injecting it directly into the egg. So depending on the method we use for the second one, it can succeed. Now, when you change your protocol, and we are sure that everything is going to be done differently, change of a protocol in the second attempt can improve the outcome of IVF. Matter of fact, statistically, For a couple to become successful in pregnancy using IVF, they have to go through more than one cycle. But there are so many women that are very lucky. Once they go for the first one, they succeed. So women who had previously failed IVF can still become pregnant naturally, so long as you do what? You ovulate. Once you modify your lifestyle, once you continue in your PPP, once you continue to watch your BMI, and you make sure you are conscious and you don't smoke, you eat a lot of fruits and vegetables. So pretty much everything is centered around health. And this is also applicable to the men. So if you can tell yourself the truth as a man, if you are so pissed, if you are not in a good place, if you see yourself as a failure because you don't have a baby yet, and you decided that you're going to take back your life, and you stop smoking, and you stop drinking, and you continue to exercise, and you sleep, and you watch your body weight, all these lifestyle modification can suddenly boost your low sperm count. So we've seen men that even had azoospermia, and we've checked the reason why they might have azoospermia. We couldn't find a particular cause. By the time they start doing the right things, exercising, drinking water, sleeping, watching what they eat, men ordinarily should increase their intake of fruits and vegetables. Fruits and vegetables will help in the process of producing the sperm. So the process of becoming pregnant is what we call garbage in, garbage out. So as a man, you actually have an advantage because men produce sperm every 3 months. So if the sperm you produced when we were going for your partner's IVF were not of good quality, but you change your lifestyle and subsequently you started living healthy, that healthy lifestyle, when you produce your sperm again, you can produce sperm with better quality. So you can produce sperm with good count, good motility, and good morphology. So lifestyle modification alone can help your partner to get you pregnant. So when we've told you you need millions to go for IVF, and you know fully well you're doing your best, some people are not doing their best, some people are just feeding on excuses. But if you know you're sourcing for money, some people will even go to the extent of selling their properties or selling a couple of things to raise the money. If you know you are not able to raise the money, don't stop your PPP. Continue love making. And another thing I've noticed personally in my organization, when you break the backbone of infertility, for some reasons, they will attract other babies. So when you succeed in breaking the backbone of infertility through any means, natural means, fertility treatment, surrogacy, adoption, once you have a baby in your home, babies have a way of attracting their siblings. So there is no never, there is no always in a family. Once you have a baby, if you have a baby boy, baby boys have a way of attracting baby girls. Baby girls have a way of attracting baby boys because in real essence, nobody wants to be alone. So your babies need siblings. So naturally, and the way God wanted, once you are able to stay on track, despite the outcome, despite what you're seeing in the physical, if you are able to stay the course, the possibility of becoming pregnant when you are shopping for IVF money, when you are shopping for IUI money, it's very, very high, regardless of your age, regardless of the duration of your infertility, regardless of the likely reason why you're having infertility. Any woman can spontaneously defeat infertility and become pregnant, including women in their 50s. Now, we need to also deal with our reality. Because you have to be doing your own part, and God will be doing his own part. When you are going through your own route, continue doing the natural things, especially if you're above 35. So the fact you had a failed IVF is not the end of the world. You can become pregnant naturally. Let me give you another example. Maybe when you went for the first IVF, you had one of few moderately big fibroid inside the cavity, maybe intramural or submucosal, and maybe the IVF provider felt it might not really be an issue. Let's not worry about it. But knowing fully well that fibroid can affect or delay your ability to become pregnant or lead to miscarriage. That's when implantation fails. Now, if after doing the review and we go back and we want to start on a clean slate and we go and have fertility sparing myomectomy. Fertility sparing myomectomy means we will carefully remove the fibroid. The fact we remove that fibroid on its own merit, you have removed a barrier. So when we remove the fibroid and you continue making love with your partner, you can become pregnant by yourself naturally. If in course of doing investigation, we did a stereoscope, we did laparoscopy, we did all those OPs, we did so many screening, and we discovered you had adhesions, and you were scheduled to do what we call adheolysis. When we remove those adhesions, you can become pregnant naturally. So the key is identifying what we can correct. If we notice you're having hormone imbalance subsequently, maybe we didn't really check properly because of prolactin, FSH, LH, and other important hormones, and we were able to correct them. When we correct them, you can easily become pregnant. Some women might also have a temporal tubal blockage. So you might have mildly blocked tube or moderately blocked tube, and we were conscientious when you went for your HSG, we flushed it, and your tubes actually became open. You might go for IVF and it will fail, and if you continue making love, you can become pregnant naturally. So generally, across the board, whether you failed in your IVF, whether you succeeded in your IVF, when you are ready again, keep on keeping on. You can become pregnant spontaneously, both naturally and with subsequent cycle. It's possible to become pregnant when you've had a failed IVF or a successful IVF. You can become pregnant naturally. How do you do this? You have to accept your reality. You have to review. You have to go back and review with your partner, review with your doctor. We need to make sure that everything is done properly. And I'm going to quickly mention key things we need to keep an eye on. The quality of the embryo. Remember, the embryo is the product of the sperm and the egg. So we need to make sure, because majority of the failure in IVF is coming from the egg. 70% of the time, most problems in failed IVF is from the egg. Now, we also need to look at the endometrial cavity. So endometrial cavity is the cover of the womb. We need to make sure it's adequate enough, it's thick enough. If we need to give you progesterone, we give you progesterone to make sure we have good size, good thickness. Age is also important. Some women might not have viable eggs, and the reason why it failed is because you need to use donor eggs. So if we check your ovarian egg reserve and you don't have good eggs, please consider using donor eggs. If the embryo didn't get to a blastocyst stage, normally an embryo that gets to a blastocyst stage will have a better advantage. Subsequently, we can try using that. Now, we need to also check your blood for a couple of antibodies. Then we do ultrasound, do hysteroscope, change the protocol. Then ultimately, some people can benefit from what we call pre-implantation genetic testing. So you can also use this. So any of the methods I mentioned can improve the possibility of you becoming pregnant even when you failed in the past. Okay, so thank you so much. So let's see what we have. How can one try again after failed IVF? This is pretty much what I've been talking about. So when you've had a failed IVF, it's emotionally wrecking. You'll be in physical pain. You'll be in emotional pain. You'll be in spiritual pain, psychological pain. When you've gone through your emotions, as you are recovering, when they call you to come back to have another cycle, deal with your reality. Your reality is your age. Your age will determine what you're going to do next. If you are going for IVF and you're 40, in our organization, we recommend using donor eggs from 40 up by default. So we wouldn't want you to insist on using your own eggs, which we know will go through what we call DOA, dead on arrival. Unfortunately, there are some women that even before they start doing IVF, it has already failed, because if you insist on using something that is not of good quality, what will happen? The yield will also not be of good quality. So the quality of the eggs and the quality of the sperm is very important. Now, when you're getting ready, don't be in a hurry to go back for another cycle. Make sure you recover in your body, in your mind, in your spirit. Exercise, try and sleep, drink only water. Make sure you're eating your fruits and vegetables. If you can put yourself in health, if you can work on your body mass index, you have a better chance of even becoming pregnant naturally. Some women might actually start receiving treatment for down regulation or up regulation before we start the IVF proper. Then suddenly they miss their period. Okay? All right. At what point does it become a waste of time and money to keep repeating IVF cycle? Very, very brilliant question from Ebenezer. So this is the deal, my people. Age is very important. So if you are above 35 and you've had 5 failed IVFs, you've been using your eggs, right? We need to hunker down. We need to go a little bit further to investigate, check the chromosomes. If it's obvious that the reason why you're not successful in your IVF is because strictly it's coming from your eggs or it's coming from your whole body, the reproductive system, then at that stage, the best thing for us is to either go for surrogacy or you go for adoption. So personally, if you've had up to 5 failed IVFs, consider donor egg, consider donor sperm, consider surrogacy, consider adoption. The earlier you consider this, the better. Now, remember that infertility and whatever you come out from infertility in regards to your treatment is a top secret between you, your partner, and your doctor. There is no other party that should know what you're doing. If there is anything to take home from me this evening, keep your infertility journey top secret. Look, I know some of you are very close to your mom. You're very close to your siblings. You're very close to some of your friends. Look, I'm telling you the truth. Sometimes the people that love us might love us the wrong way. Love is still love. But they might love us like your mom might love you, but she goes to the village church because she believes that's where you're going to get help. And she tells the parish priest, oh, my daughter is married for 15 years. She doesn't have a baby. She's not going for IVF. What will happen on Sunday? The parish priest will man the pulpit and use your daughter to preach or come for a special prayer. Now, before you know it, the whole community will know everything about your business. Your infertility journey, your infertility management, your infertility choices is strictly between you and your partner. Whatever you tell your doctor stays with your doctor. So there are so many other ways you can encourage our parents, because sometimes our parents are even more worried than us. They don't even feel our pain. They don't even understand how you feel that you don't have a baby. They are, looking at it from their perspective of numbers. So they're already calculating the number of grandkids they have, or a couple of things, which is okay. Mothers are going to be mothers. But the question is, what do you need to do if you are 45 and you don't have a baby and it's been 15 years? What are you going to do? What's the practical thing to do? What step do you need to take? Some couples can have what we call infertility of unknown origin or unexplained infertility. If you happen to be in your 40s, as I'm talking to you right now, what are you going to do realistically? Besides being sentimental, what are the practical steps to take? So these are the things you need to ask yourself. So when you get to that point, we've had women that had 6 failed IUIs. When you've had that failed IUIs, it's time to graduate to IVF. IVF is always superior to IUI, but at least check the boxes. IVF is not always the first option. We would have tried fertility treatment, IUI, and after so many failures, then we go back to IVF. And there are different types of IVFs, okay? So try your best to give your best, okay? All right. How can one handle the fear of trying again after failed IVF? You need to go for counseling. You need to have a compassionate and understanding provider who will explain it to you. Unfortunately, most doctors are not explaining to these women what happened. Some of them will not even give you what to do. They just pump your body and, it's more like trial and error. But part of journey in life is all about closure. So if you understand what happened, if you understand your expectations, if you understand the probability of good or bad, then you can begin to make informed decisions. So fear, it's actually a big enemy in getting results, because fear can make you not to even take those steps. Let's assume since 2021, you've been so afraid. Anytime your period comes, you're so worried, you're so fearful, and you haven't taken those steps. And you don't even have a doctor attached to you. And you're so afraid. September is coming. Before you know it, it's October, it's November, it's another December. There are so many people that go into depression by December because you look at your friends, you look at everybody, it looks like they're having babies, and you still don't have a baby. So fear can put you in a bad place. You can flip your fear into faith, or fear can steal your faith. So anytime fear knocks on your door, let faith arise. Fear should wake you up to action. Fear should make you to seek help from a fertility specialist. Fear should tell you, you know what? Let me deal with my reality. I'm 45. Let's go for donor egg. Let's go for donor sperm. Let's go for adoption. Let's go for surrogacy. Unfortunately, these are all expensive. So when you are afraid of something, that's where courage will come in. What's courage? Courage is the ability to still be afraid and fearful, but still do it anyway. So courageous women and men can easily become parents when you don't give up. Very important. If egg quality is the issue, what supplement can help? This is another important question. Now, let's keep it real. Your eggs do not respond to any external thing because your eggs are already there. The eggs you have is what you're going to use. Now, a couple of IVF providers might give you a couple of supplements, which, from anecdotal studies, they believe that it's going to do this, it's going to do that. But this is the reality. So I won't give you high hopes. Unfortunately, some people can package a lot of things and tell you, oh, it's going to boost your egg, it's going to do this, it's going to boost your sperm, it's going to boost your egg. Matter of fact, those are the fastest selling drugs. If I want to be a billionaire today, I can go to Nigeria and package one thing and be selling sperm booster, egg booster. My people, when you have your eggs, which God gave you, if you use them early before you go into menopause, what you have is what you ovulate. So there is no magic drug out there that once you pop it, you begin to have quality eggs. You cannot affect the quality of your eggs. What you have is what you use. But in some situations, we can give you a couple of super supplements to see if we can do it to an extent. But I love evidence. So I love working with evidence. So the concept of boosting your eggs or not boosting your eggs, or boosting your sperm or not boosting your sperm, it's more of giving people kind of, things they want to hear about and they feel good about it. But we don't have time to deceive people in our group. We tell you the truth. Okay, so if we discover your eggs are not of good quality, the best thing to do is to go for donor eggs. If you're going for donor eggs, guess the people that will know you're going for donor eggs? Only you and your partner. But guess what? If you tell your mother, mothers and daughters do quarrel. You have your good days and bad days. The days you guys are going to quarrel, she's going to use it against you. And if you're the type that tells your mom everything about your partner, or your partner tells their mom about everything about you, when they're in good terms, they can confide in each other. They can break the family secret. When they're not in good terms, they will use it against you. Your siblings can use it against you. Your friends can use it against you. They can talk at your back. But when you know you don't owe anybody, you just do your thing. So many people are avoiding the villages because you believe, oh, you don't have this, so you don't go to the villages. You don't show up for social function. Why don't you show up in 2022 with your babies, with your twins, with your triplets? It's possible. Be happy for you. Become a mother for you. Don't become a mother because of your mother. Don't become a mother to check the box for the society so they will like you. It doesn't matter. Just do what you need to do right now. Very important. Okay? All right. Would there be any harm in taking progesterone to improve your fertility while trying to conceive naturally during the break before trying for IVF again? You don't take any drug by yourself, especially hormone-related drugs. Progesterone can be a good enemy, and it can also mess you up. Estrogen can be a good enemy, and it can also be a good friend. FSH, LH, these are all hormone drugs. It needs to be regulated. There are specific levels. We need to have them in the body. So when you begin to take them without monitoring, without need, you're going to mess yourself up. So you don't need to take any external hormone-related drugs. If your doctor didn't give it to you, don't take it. What you need to focus on, it's lifestyle modification. So exercise, rest, sleep, drink water, eat good food, avoid stress. Definitely you're going to get there. You're going to mount the podium. Nothing can stop you. Okay, so be careful. Don't take any external drug which your doctor didn't give you. Okay? All right. Do we have any other question? Okay, Benisa, please, can you share the topic for tomorrow? Remember to register for our gender selection super masterclass. It's super masterclass. Super masterclass means you're going to be well informed. When you're well informed, you can go back and fix your home. The things you're fighting for, the things you're going to the wrong places, thinking you're going to get a result. There are ways you can get a boy. There are ways you can get a girl. It might be a little bit pricey, but you can get them. So if that's what's causing you sleepless night, why don't you come? Let's fellowship so we can learn together. Okay? All right. Please ask Ebenezer, please share the topic for tomorrow so our members can learn. Now, please, if today is the first day of attending our YouTube live stream, please make sure you subscribe. Okay? When you subscribe, click on the notification button so that subsequent videos We are going to be aware and you're going to follow through. And you can also go back and review the previous videos. Okay, tomorrow, how to have successful IUI. So tomorrow we're going to go to intrauterine insemination, also called artificial insemination. Artificial insemination. Intrauterine insemination simply means instead of allowing the penis to go inside the vagina, we use a special catheter. We collect the sperm, we wash the sperm, and we deposit it directly into the cavity. So we're going to talk about how you can have successful IUI tomorrow. Okay, thank you for coming. I hope to see you tomorrow. Remember, when everything else fails, continue to pray. Prayer works. Prayer is magical. Pray and continue to make love with your partner 48 hourly. Then continue to practice. Seek higher understanding. Seek help. Allow the knowledge you learn from me every day to give you good understanding. Unfortunately, some women show up, they know the truth, they have the knowledge. But when they go back, they begin to see things where there are no things. And where there are things, you don't see them. So let's take action while we can, okay? Remember, age is the most important thing that will help you to become a mother or that can stop you from becoming a mother. Thank you so much. I appreciate you guys. I'll see you guys tomorrow. Bye-bye for now.